Hello, my name is Meg Carmen, and I serve as the lead faculty for the Adult-Gerontology Acute Care Nurse Practitioner Postgraduate Certificate Program here at the University of North Carolina in Chapel Hill. We're very excited about your interest in our program, and we thought we'd take a few moments to answer some of the questions that you may have. Let's give you a little bit of background first. We are very proud of our first cohort of acute care NPs who graduated in May of 2022. But the school had been considering this program for a very long period of time, hoping to develop an option for nurse practitioners in our state who are already certified in primary care, but perhaps practicing in the acute or critical care setting, and then those who may have become educated and certified as a primary care nurse practitioner, but really miss the challenge of working with patients who have time-sensitive issues, are very, very complex, or perhaps even technologically dependent. So if that's you, this may be the program for you. At the same time, the landscape in North Carolina is changing. The North Carolina Board of Nursing is increasingly viewing and looking at the alignment of education, certification, so your preparation with the scope of practice in your clinical job. And so it's much more difficult to accept and to begin working in a position where you'll be required to understand and to manage patients who are acutely ill if you don't have the degree and the certification to do so. Let's take a look at the curriculum. So in the acute care program, it is a year-long program that is a total of 18 credit hours delivered over 3 terms. It does require that you complete 660 hours of clinical time, some of that being at our on-campus immersions for things like skills training and simulations. In semester 1, this is more of a hospitalist approach. We look at topics that would be seen on the floor, perhaps the progressive care unit, things like the management of patients with acute endocrine conditions, pneumonia, etc. So that's nursing 8:30. There's didactic content. We have some voluntary live class sessions, as I'll get to in a moment, and you're going to complete 150 hours in your clinical experience. Along with that, there's a 1-credit pharmacology for acute care course, Nursing 831, that is intended to fill in the blanks that you may need from your foundational graduate level pharmacology course. Things like procedural sedation, vasopressor management that you didn't get in the more broad graduate level course will be filled in here. From there, we move on to semester 2. This is an intensivist approach. We're talking about critical care topics. Things like neurocritical care, the management of patients with subarachnoid hemorrhage, patients who are technologically dependent, perhaps on ECMO, ventilatory management, etc. That will be delivered in Nursing 832, your second clinical course, and it will require 210 hours of time in the clinical rotation. And then we get to semester 3, preparation, getting you ready for practice. This includes 2 courses, a 1-credit acute care seminar course, Nursing 834, I should say there, and that will cover professional practice topics, getting ready for certification, how do you go about that process, what happens after you graduate. But we also have clinical topics such as transitioning from the critical care to the palliative care trajectory. Things like the management of patients who are technologically dependent. What are the new technologies? What are some of the new drugs that are coming out? Those are all covered in the seminar course. And along with that, you will complete your Adult-Gerontology Acute Care NP practicum, which is a total of 240 hours. Now, that doesn't add up to 660 hours. We do allot 60 hours of time for your clinical requirement towards the hours that you put in through 3 on-campus immersions. Our learning activities for the program include weekly online asynchronous, so not at the same time, lecture content. These are recorded lectures, which are then applied with different case studies and virtual simulations at a voluntary live weekly class session on Zoom. So it's quite flexible. If you're out there working, you can listen to the didactic content at your leisure, complete a lot of the assignments and activities on your own time. But there is the option to come to class on a weekly basis so that you can engage with other students, engage one-on-one with faculty, and get any questions answered. So you're not out there learning on your own. We do use different platforms. One is called RealDX, another is called iSimulate to complete virtual simulations. These are online via Zoom, but have the capability of turning your computer into a cardiac monitor. You'll have the ability to defibrillate, to pace, and to see the hemodynamic changes that will occur when you with the orders that you deliver. You will always have clinical faculty support for every clinical rotation to which you are assigned. A faculty member from the School of Nursing is responsible for coordinating with both you and your clinical preceptor to make sure that you are meeting the course objectives, and if you're having any problems, to make sure that we get you back on track so you do successfully complete each course. And then lastly, we have 3 on-campus immersions during the program. The first being at the very start of your program to get you started on the right foot. The second immersion being at the midpoint of the semester so that we can begin to practice the skills that you are learning in your weekly content. Ventilator management, management of different shock states, etc. And we do that through skills training, high fidelity simulations. We do have standardized patient encounters in the simulation setting in the simulation center that we use so that you are not always working with mannequins, but with real human beings. And then lastly, students really enjoy our point of care ultrasound sessions. So those on-campus sessions, the on-campus immersions, are at currently at the Ambulatory Care Center, which is right on campus here at UNC Chapel Hill. And we hope in the future to be at the new School of Nursing, which is going to be built over the next several years. Your clinical experiences, this is always a big question for prospective students. At UNC, clinical experiences are considered a partnership. You will work with the program, the course faculty, including myself, to talk about what your goals and objectives are. What is your career pathway, and where is it that you are hoping to end as an acute care nurse practitioner? If you're interested in CT ICU and that is the only thing you ever want to do, we can work with you and develop clinical experiences that are going to enrich and support you in your goals. If you have no idea what you want to do, that is fine. We can think about what variety of experiences might prepare you as more of a generalist as an acute care nurse practitioner. So we can plan different clinical experiences according to your level of experience prior to coming, as well as what your future goals are. But it is definitely a partnership, and the faculty will work in collaboration with you and our clinical support staff in order to plan and execute these clinical rotations. If you have a preceptor that you would like to use, we would very much appreciate you connecting us with them and starting that communication. But if you don't have someone, then we're going to work with you to identify where and who might be a good preceptor for you. You are not out there alone, but we want to work with you in partnership to make sure that you get the experiences that you want and need. What is it that we are using in order to build the curriculum for our AG-ACN program? Well, the program is based on and uses as a conceptual model the American Association of Critical Care Nurses Synergy Model for Clinical Excellence. That is our professional organization for acute care nurse practitioners. And they also develop the competencies for acute care nurse practitioners. So each week, when we talk about different case studies, we're always going to go back to the synergy model and look at it from the perspective of the patient's characteristics, the nurse practitioner competencies, and how that all works and navigates within a very complex healthcare system. We will, of course, look at our school's values, the Carolina core tenets, and I encourage you to look at those as you're considering our school and to see those as our values as those are embedded into each week and each lecture that is delivered. And then we also utilize the essentials for nursing education, which guide the curriculum through established domains and competencies as nursing education as a whole is moving towards competency-based education. At the end of the day, after graduation, you will be eligible to test through the American Nurses Credentialing Center, ANCC, or the American Association of Critical Care Nurses certification organization, which also offers the AG-ACNP certification exam. For further information on admissions and financial aid, you can contact Brianna Colbert at the UNC School of Nursing. I have her information here. Our applications for admission to the fall 2023 cohort are open now through November 21st, 2022. You are expected to have 6 months of acute care experience within the past 2 years. So that can be as an acute care nurse. Critical care experience is strongly encouraged, but you can be a nurse or a nurse practitioner practicing within acute care 6 months out of the past 2 years. We also strongly encourage membership to the American Association of Critical Care Nurses and specialty certification, such as the CCRN, the Certified Emergency Nurse Practitioner certification, etc. On the financial aid side of things, I have given you the link for a PDF that's been developed specific to the AG-ACNP program here at UNC. And that can also be found at our website, nursing.unc.edu. This is a great time in terms of the future of NP education. With the new essentials for nursing education, we have very strong new competencies that we have built into the curriculum. The current call is that the Doctor of Nursing Practice be established as entry to practice with a goal of 2025. So if you're coming back now to get that post-grad certificate, although the DNP is a wonderful degree to have, if you're hoping just to add this in, this is a good time to do it. And the National Task Force criteria established by the National Organization of Nurse Practitioner Faculty has recently updated their guidelines and criteria. So we have a program that is current, it is relevant, and we are ready for our incoming cohort. We look forward to seeing you hopefully next fall. If you have any questions, please feel to reach out. I am on the UNC website. My email is carma002@email.unc.edu, and we look forward to hearing from you. Thank you.